forward, fall back. Spring forward, fall back. Today, of course, we fell back. So we've gotten used to changing our clocks twice a year. But is it time to stop this tradition?
We need to get rid of the time change. Absolutely. I'm waiting for it.
I could stay with, like, just standard time.
We should probably keep it. I don't see the big deal.
Last year, a bipartisan bill called the Sunshine Protection Act unanimously passed in the U.S. Senate. It would make daylight saving time permanent, but the legislation is currently stalled in the House. Now, part of the debate around this issue is how it impacts our health. Invasive cardiologist Dr. Fahmi Farah joins us now to discuss. Doctor, thank you so much for your time today. So how can this 1 hour change have such a big effect on us?
Thank you for having me. That is a debatable question. We do have some studies that show that change in sleep pattern can have some effect to your overall health and, of course, your cardiac health as well. Whether the 1 hour makes a huge difference or not, that is still debatable. But I'm going to talk about sleep disturbance. You know, any kind of change can cause a change to our circadian rhythm, which is our biological clock. And that can really disrupt our sleep pattern. And for those of us who are sensitive, that can throw us off and cause sleep disturbance. And if we don't get adequate sleep, it can have a detrimental impact on our health. Recently, the American Heart Association has added sleep as a risk factor for cardiovascular disease, just like high blood pressure, diabetes, high cholesterol are risk factors to increase risk of having cardiac issues like heart attack and increased stroke and those things. Sleep is one of them. So getting adequate sleep is very important, and yes, it can affect your health.
So what would be better for our health then? Would it be a permanent daylight saving time, or should we continue going back and forth?
That is a difficult question to answer, but my advice to those, whether daylight saving stays or goes, regardless, that 1 hour change, is it a huge impact for your health? That we don't know yet. But for those of us who are sensitive to such a change, my advice to them would be to allow a gradual change into your sleep pattern. So before the sleep, the 1 hour change comes up, I usually suggest people a week before, do it in increments of 15 to 20 minutes, either go to sleep early or late, depending on what kind of change we're looking at. Spring forward, for example, it would be earlier, and just gradually increase that time frame so that your circadian rhythm doesn't get thrown off. When we do it gradually, we don't feel the impact as badly.
Dr. Farah, thank you so much for your time and joining us today. We appreciate it.
Thank you so much for having me. It was a pleasure.
Now, there are parts of the U.S. that do not recognize daylight saving time, including Hawaii and most of Arizona. If the Sunshine Protection Act ends up making it through the House and onto the president's desk, today could be the last time we actually fall back.